Hello all, welcome you to for the next part of the question paper discussion. So previously in the video I have told that one question related with a female engineer. 12 to 14 hour work was there, eating mainly junk food, no fruits and vegetable, HP was decreased and increased MCV diagnosis. I have mistakenly told it is vitamin B12 deficiency anemia. It is not vitamin B12 deficiency, it is folate deficiency anemia. In case if you are getting any neurological symptoms associated with the anemia like numbness, paresthesia or pain is there in the muscles, so like that of symptoms if they are telling, then go for vitamin B12 deficiency anemia. If just they are simply telling only increased MCV, HB is decreased, fatigue, paleness, so such type only they are telling, then go for folate deficiency anemia. Okay, so just if you have written vitamin B12 deficiency, just mark it as it is a folate deficiency anemia. Okay, so please correct that one. Next question was last video itself I have given you one question, irregular period for 1 year, weight loss, and she was one of the member in the school gymnastics. So I have given the option is female athlete triad. If it is female athlete triad, that option is not there. Okay, if you have found hypogonadotropic hypogonadism, then go for this option. Okay, in case female athlete triad option is not there, go for the next option is hypogonadotropic hypogonadism. Okay. So hypogonadotropic hypogonadism means here the hypothalamus will not be functioning properly. Okay, because of that what happened, there will be decreased secretion of GnRH, and through that way anterior part of the pituitary gland will not be secreting FSH and LH, and because of the deficiency of the FSH and LH, the proper follicles will not be developing and it can result in the amenorrhea. Okay. So, to getting hypogonadotropic hypogonadism, one of the reason for getting that condition is exercise. Severe exercise also one of the reason for getting hypogonadotropic hypogonadism. Okay, you can see in the picture, due to the dysfunction of the gonads, okay, maybe like a radiation therapy or a chemotherapy or autoimmunity, trauma, infections, okay, or any genetical disorders. Okay, directly they are the gonads are not functioning properly. Okay, another thing is due to the hypothalamus or pituitary gland dysfunction. Okay, due to the hypothalamus or pituitary gland dysfunction, that is due to maybe any tumor, a pituitary apoplexy, base of the skull trauma. Okay, then hypopituitarism, Kallmann syndrome, chronic illness, malnutrition, obesity, excessive exercise and stress. Okay, so these are the causative factors. Okay, because of these reasons what happen, you can see hypothalamus function will become reduces. Okay, hypothalamus or anterior part of the pituitary gland function will reduces. Okay, any one of the part will be reducing. Okay, if hypothalamus function is reducing, there will be reduced GnRH secretion. Okay, GnRH, gonadotropin releasing hormone, this is released by the hypothalamus, and this GnRH will act on the anterior pituitary, then they will be releasing the LH hormone and FSH hormone. Okay, so if you have a problem in the hypothalamus, there will be GnRH secretion will not be happening, and because of that what happen, anterior pituitary will not secrete LH and FSH. Or otherwise if you have got a problem in the pituitary gland also will lead to the reduced secretion of LH and FSH, and because of the reduced secretion of LH and FSH what happen, it result in the proper formation of the follicles will not be forming. Okay, hypogonadism. Okay, hypogonads mean testis and ovary. So in the females, ovaries will not be working properly. Okay, so hypogonadism is happening. Okay, so because of that what happened, the patient will be suffering with the amenorrhea. Okay, weight loss, all those things will be there. So you can see the sign and symptom: delayed puberty, primary amenorrhea, changes in the mood and energy, infertility, decreased libido, erectile dysfunction. Okay, so these are the sign and symptoms. So if you couldn't get female athlete triad, then go for the option hypogonadotropic hypogonadism. There also, because of the excessive, because the patient is in the gymnastic, so they will be doing excessively exercise like activities, all those things are there, so it can result in the dysfunction of the hypothalamus or pituitary, or because of that they can get this irregular periods will be there, weight loss will be there, and properly they will not be taking food, all those things. So it can result in hypogonadotropic hypogonadism. Next question was regarding vulval itching with a white parchment. Okay, so with that one question was there. Answer was lichen sclerosus. Okay, so lichen sclerosus means white spot disease. Okay, it is a condition which is affecting the genital area. In the genital area, you will be getting a thin white patches of the skin will be there. Okay, white patches of the skin will be there. You can see here in the picture they have shown white patches with a severe itching sensation, that is called as lichen sclerosus. Okay, usually it is affecting in the genital and the anal areas. Okay, patchy white skin will be appearing plus severe itching sensation will be there. So that is called as lichen sclerosus, or otherwise known as white spot disease. Along with the white patchy skin, you can get blisters also, sore also you can get it. Okay, it is an inflammatory condition. If you are not treating properly this condition, it can lead to the scarring. Okay, and it can lead to dyspareunia, dysuria, dyschexia. Okay, dyschexia means there is a pain in the anal region. Okay, so this type of symptoms you can get it. Okay, so it is an inflammatory condition. If you are not treating properly, it can lead to scarring, dyspareunia, dysuria, dyschexia. So like that of condition can happen, and later it can develop into skin cancer also. Okay, like if it is affecting in the penis, it can lead to penile cancer, or in the vaginal area. It's not inside the vagina, outside portion of the vagina, which means in the vulval area. There you are getting this skin lesion, so that it will lead to the squamous cell carcinoma. Okay, if we are not treating properly, it can lead to the cancer condition. If it is in the penile region, penile carcinoma. In the vulvar region, you will be getting squamous cell carcinoma. So the symptoms are severe redness will be there, discomfort or pain will be there, itching sensation, pruritus, which can be severe. Smooth white patches on the skin you can see in the genital area. Blotchy wrinkled patches, tearing or bleeding you can see. In severe cases it leads to bleeding, blistering, ulcerated sore, and painful sex also you will be getting. So these are the symptoms of the lichen sclerosus. It is an inflammatory condition. Usually it is affecting in the menstruating women. Okay, like not menstruating, like this before menstrual cycle. Okay, the girls they will be getting, and postmenopausal women. So these are the people they use commonly they used to get it. Okay, the girls who have not started menstruating, and those who are in the postmenopausal women. Okay, these are the common people. Menstruating women also can get it, but commonly we used to see in the girls who have not started menstruating, and those who are in the postmenopausal stage. Next question was, after pneumonia, proximal and distal muscle weakness, paralysis are getting. So what was the condition? It was a question. So the answer was Guillain-Barré syndrome. So Guillain-Barré syndrome means it is an autoimmune condition. Okay, autoimmune condition means our immune system will be thinking that our cells are in a foreign body, like that they will be attacking. Okay, our immune system will be attacking our own cells. Okay, so through that you are getting a disorder that is called as Guillain-Barré syndrome. Okay, through the autoimmune activity here, what they are destroying is the our cells which is responsible for the formation of myelin sheet. Okay, the cell which helps in the formation of myelin sheet, that will become damaged. Okay, our immune system will be damaging the myelin sheet of the nervous system, and through the myelin sheet is damaged, then what happens? The proper impulse transmission will not be happening, so it result in the paralysis. Okay, the main factor for getting this disorder is the infectious condition. Okay, maybe pneumonia or any other bacterial infection, Campylobacter jejuni, E. coli. Okay, so such type of any bacterial infection has happened in the body. Okay, so this bacteria will be releasing some toxins. Okay, so after this infection will be going on, this toxins will be show some toxins will be having some cells which is similar to the cells of the myelin sheet. Okay, this infectious condition, the pneumonia, Campylobacter or E. coli, they will have some cells will be there. That cell will be having similar to the cell of myelin sheet. So what happened? The immune system is thinking that this bacteria is also bacteria they will be killing. At the same time, the same type of cell you can see in the myelin sheet. So what happened? They will get confused. So because of that confusion, what they will do? They will kill that E. coli or this type of bacteria. At the same time, they will kill the cells of the myelin sheet. Okay, so because of that what happened, the myelin sheet damage will be happening. So first of all, always there will be a infectious condition will be happening. After that only this Guillain-Barré syndrome will be happening. So that's why in the question after pneumonia this weaknesses they have told. So that was a one point for diagnosing Guillain-Barré syndrome. Okay, so they will be damaging the myelin sheet. Then what happened? First of all, you are getting paralysis in the leg area. Okay, leg, in the distal portion, in the distal muscle you will be getting weakness, and this weakness will be slowly increasing into the trunk region. Okay, first you will be getting paralysis in the leg, then slowly this it will be moving into the trunk and then into the face area. So like that of that paralysis will be going on. So this type of paralysis is called as ascending paralysis. Okay, so first of all they will be getting an infection. You can see triggered by an infection. Okay, paralysis you will be starting from the legs. Okay, so these are the key diagnostic feature for identifying the Guillain-Barré syndrome. Ascending symmetrical muscle weakness, which means ascending means both the side, right side, left side, both the legs will be first of all affected, then slowly it will be paralysis will be moving upward. Okay, lower extremity weakness you will be getting, then it will be going upward direction. Then what happen? You will be getting respiratory failure. Okay, so these are the symptoms of the Guillain-Barré syndrome. So main thing is the triggering factor for getting Guillain-Barré syndrome is infection. Then after that you will be getting distal muscle weakness. That means first you will be getting in the leg area, then slowly the paralysis will be moving upward direction. Then you will be getting in the proximal muscle weakness. Okay, so this is about the Guillain-Barré syndrome. So it is an autoimmune disorder. Next question was sudden onset of severe headache, vomiting. On examination, neck rigidity was there and no neurological deficit was there. Okay, if you just examine the neurological examination, there will be no problem. Then what was the diagnosis? So intracerebral bleed, subarachnoid hemorrhage, meningitis, meningoencephalitis option was there. So the correct answer is subarachnoid hemorrhage. Okay, subarachnoid hemorrhage means you are getting bleeding in the subarachnoid space. Okay, and the same answer you are getting in another one more question also. Violent headache, vomiting, neck stiffness, and also says that never had such severe headache before. Okay, so in this type of headache never they have experienced in that life. So that much severe headache the patient had. So this type of one sentence also indicating the patient is suffering with a subarachnoid hemorrhage. Okay, both the question answers are subarachnoid hemorrhage. So subarachnoid space means, first of all we have to know that brain is covered by a layer called meninges. Okay, so meninges has 3 layers. Okay, meninges is the covering of the brain. It has 3 layers: dura mater, arachnoid matter and pia mater. These are the 3 layers of the meninges. Okay, so between the dura mater and arachnoid matter there is a small space is there, that is called as subdural space. Okay, in between dura mater and arachnoid matter there is a space is there, that is called subdural space, and between the arachnoid matter and pia mater there is a space is called subarachnoid space. Between the arachnoid matter and pia mater. So in that area you are getting the bleeding. Okay, so what are the main symptoms of the subarachnoid hemorrhage is the severe thunderclap headache. A thunder is happening in our body, how much pain will be there in that way. Okay, thunderclap headache, which is a very intense and painful headache. The patient will be telling such a severe headache they have never experienced in their life before. So like that of one sentence always they will be telling. So those who have suffered with a subarachnoid hemorrhage. So if that bleeding is happening in the subarachnoid area, then what are the symptoms you will be getting? Decreased consciousness, alertness, nausea, vomiting, stiffness in the neck, sudden weakness will be there, dizziness, numbness in the parts of the body, muscle ache, especially in the neck and shoulder area, severe muscle ache will be there. Eye sensitivity to the bright light, photosensitivity, then seizures will get, mood and personality changes will be there, including confusion, irritability, vision changes, including double vision, blind spot, temporary vision loss in one eye. So these are the symptoms of the subarachnoid hemorrhage. Okay, so this was the diagnosis for these two conditions. So suddenly your patient has got severe headache, vomiting is there, examination, neck rigidity is there. Okay, that neck stiffness, but neurological deficit is not there, then subarachnoid hemorrhage. Then violent headache. Okay, so also they are telling never had such a severe headache before. Then vomiting, neck stiffness. Okay, so these are all indicating subarachnoid hemorrhage. Both the conditions are, option is subarachnoid hemorrhage. So the causes for getting subarachnoid hemorrhage is the ruptured aneurysm, brain aneurysm. Okay, that is the main reason for getting subarachnoid hemorrhage, ruptured brain aneurysm. Aneurysm means it is a dilatation is happening in the blood vessel. Because of the weakening of the blood vessel wall, there is a small elevation like a balloon like structure will be forming, that is called aneurysm. Okay, due to the weakness of the blood vessel wall, there is a small dilatation is happening, that is called aneurysm. So those who are having this brain aneurysm, so they will rupture. Okay, maybe because of the stress or trauma they will rupture. So that time they used to get subarachnoid hemorrhage. So that is the most common reason for getting subarachnoid hemorrhage, ruptured aneurysm. Then other factors like high blood pressure. Okay, then those who are suffering with the Ehlers-Danlos syndrome, fibromuscular dysplasia, polycystic kidney disease. So these are the causative factors for getting subarachnoid hemorrhage. Okay, so rest of the things we'll discuss in the next video.